This video, we're going to talk briefly about the distribution of photoreceptors within the retina. And if we go to the bottom first, actually, we look directly into the eye. We'd be looking at the retina. So this is an anterior view of the retina here. And what we find is that the distribution of photoreceptors is nonlinear. And so what we're going to see is that we have two main categories of photoreceptors, the rods and the cones. And in this central region, found here, known as the macula lutea, we start to find a very high density of cones and very few rods. And actually, if we look at the very center of that, what's called the fovea centralis, we have cones only. And they actually are very small cones. And this differential distribution of rods and cones is actually going to provide different versions of vision for our central vision versus our peripheral vision. And what I mean by that is when you look directly at something, the light enters the eye and it's going to hit some region of this macula lutea. And again, it depends on the size of the thing that you're actually looking at. But very small objects would be focused directly on the fovea centralis as you look at them. However, light that enters the eye at an angle, right, would end up hitting the peripheral retina, somewhere to the sides. And as we'll see in a moment, that's going to hit areas that are much higher in rod density. Now, if we go up a level here, if we were to look at the retina from the side, right, we see these same structures, but now it looks like the back curvature of the eyeball here. We still have our macula lutea here with the fovea centralis in the center. We do have this region called the optic disc. And photoreceptors actually synapse with what are called bipolar cells, and the bipolar cells synapse with what are referred to as ganglion cells. And so this is how information actually leaves the back of the eye, leaves the retina. And so those ganglion cells actually send their axons from different regions of the eye, right? There are photoreceptors out here or more centrally. And all of those are going to send their axons out through this optic nerve. And if we look at the top here, if we go up and we look at the photoreceptor distribution, what we find at the optic nerve is that we don't have any photoreceptors at all, right? So that's actually a blind spot on the back of the eye in that region of the retina. Now, if we look at the distribution across the surface of the retina here, right, basically going anatomically straight up from these regions, right, we see that the peripheral retina, as we mentioned before, is very high in rods, shown by this dashed red line, right? And then their density falls dramatically when we reach the visual axis, the center of the retina. But what we find is that the density of cones rises dramatically, right? And of course, over here, where our optic nerve leads, we have neither rods nor cones. Now, the interesting thing is that cones are adapted for use, or their activity is optimized in bright light, and because there are three different versions of them, they provide color vision. And so when we look directly at something, we get a very high acuity, high definition image of it. And as long as the light is bright, we will get a very brightly colored image. Now, objects in the periphery of our vision are going to also hit cones. There are still cones out here, but they're going to hit a much higher density of rods. Now, in low light levels, the rods become much more active for reasons of neural convergence. They actually undergo much more neural convergence, making them much more sensitive overall. And so our peripheral retina is much more sensitive to low light levels, but because rods only come in one version, our low light color sensitivity falls off dramatically.